Welcome back, you beautiful people. Another episode of Medshield Movement Connect show with me, Dr. Fez. We live in a world where there's a lot of information. People tell you to eat this, but not to eat that. It's better to cut out this so you can look this kind of way. And we thought that we should address these issues around nutrition with somebody who is very knowledgeable, a dietitian, Sumaiya Essa. Get ready to know what you don't know about being body brilliant. This is the Medshield Movement Connect show, where we connect the dots between fitness, health, wellness, nutrition, and of course you. Hosted by me, Dr. Fez Mkhize, and a special guest that we have every month, sharing knowledge, insights, and groundbreaking tips on how to get fitter, be stronger, and live healthier. Turn up the volume and listen close. Today you amplify. It's the Medshield Movement Connect show. Let's go. Thank you so much for sitting down with us, man.
Perfect. That's how you.
Oh, pretty good. Actually, that's the first time somebody's
Someone's
asked,
how you are.
is this a dietitian thing where you're just trying to make sure that I'm nourished internally, spiritually?
Maybe. It could be a dietitian thing or maybe just a people thing from my side.
I love that. But speaking of the fact that you are a dietitian,
Yes.
I don't know if a lot of people at home have ever come into consultation with a dietitian.
Yes.
What is it that made you want to go into the specific kind of speciality or into the medical scheme itself?
Yeah, so I think when I was choosing my profession, I wanted to choose something that would be practical, that I could apply to my personal life as well. Also something that I could be flexible with if I wanted to have a family someday and be flexible with my hours and be my own boss. And I also loved healthcare. And then I thought everything is affected by what you eat, right? Because you are what you eat. So then I looked into dietetics and became a dietitian.
So as a dietitian,
Yeah.
you've said all of these things, and it is something that's very important because that's our contact kind of with the world. We ingest things and they kind of help us, or they make things a bit harder for us.
Yeah.
What have you found is the ideology or the thought process around dietitian and nutrition in South Africa, or dieting in South Africa?
Yeah, I think we have this obesity pandemic because everyone's been very unhealthy. Yeah, 100%. I actually think it's a global issue. And I think since lockdown, maybe it's gotten a bit worse with everyone sitting at home. I actually got really busy after lockdown, which was quite nice. But I think that nutrition's become really complicated because everyone has an opinion. I think maybe because people think that they can just tell everyone else how to eat. And I think nowadays there's lots of influential people with opinions. And so everything's become complicated, confusing, conflicting, and everyone's just been trying so many things and just not finding that balance. So I think if you go to a dietitian, that's what you'd get. You'd get the simple, sustainable, easy approach that you could do long term, because you want longevity with your eating, because healthy is forever, right? So versus trying all these trends and fads, I think that's just what people are confused about and need more information on.
I mean, you speak to, if somebody, if I were to come to you and ask for consultation, and of course, I'm sure you encompass a lot of kind of thought and how I am as a person, all of these things that factor into what you would then suggest in terms of a managed plan.
Yeah.
What are some of the key principles, if I come in, that you are considering and then you roll out with the treatment that you get?
So we'd have to look at your lifestyle in general. So I'd obviously do a full diet history, check what you've currently been doing, maybe with your job, if you have lots of traveling, training, exercising, what your training goals are, cultural background, religious background, all of those things affect the way that you eat. So we'd look at all of that. So the one thing with seeing a dietitian that you can definitely guarantee is personalization, because we wouldn't do the same thing for everyone. And I think that's what makes it special. Yeah.
Now, hearing you, and I know everything's tailored to each person, and you're somebody who, if I were to come in, there'd be all these things that you'd consider.
Yeah.
I still kind of want to know your thought process around a lot of these trends of eating.
Okay.
I don't want to name any specific kind of trend, but
It's not.
take this and don't eat that, and this will make you lose weight, and this kind of won't. What is your philosophy around those buzz or trendy diet plans?
Yeah, so I think what happens is they just get very restrictive, right? They always sort of demonize one sort of food group and completely cut it out, and then that makes it unsustainable, especially if it just comes to being social. I mean, how can you not then have an entire food group if that's what everyone's doing? So I think just balance is important. So most of how to spot like a something faddy, maybe see that it's not balanced, and that's what you'd want to aim for. Yeah.
I mean, and this is what I always tell people, because thankfully I've been able to try. I mean, I fell into some of these, oh, do this and it'll make you kind of feel this way or look this way. And I've tried a number of them, and I find it is coming down to balance. And vilifying, making like a certain food group or thing evil, also then ends up having this weird psychological connection when it comes to you and food. And I mean, in your practice, do you find that some people come in and they kind of have that negativity when it comes to certain food groups? And how do you break that psychological training? Because I feel like it is training, because
100%.
you reinforce it, and social media might show you an image and be like, you look like this, and if you do this, then you won't look like this.
Yeah.
So how is it that you kind of, or have you seen that, and how do you tackle it?
Yeah, so I think there definitely are some fears around certain food groups after following a certain fad that said like, don't eat this, and then you completely cut it out, and now you actually feel afraid to start including it again. So I think just explaining to patients the reason why you need it, the benefits of having it, and then slowly reintroducing it back into their diet. Because you have to remember that eating is not just like nourishing yourself, it's also a behavior. So, you know, people need to relearn food behaviors and being comfortable with food again. So we actually definitely look into the psychology behind that as well. Yeah.
Food behaviors, I love that.
Yeah.
And
Mindful eating.
Mindful eating. And I feel like when it comes to these kind of topics, it is because there is this pressure to look a certain way, because we are now being bombarded with certain images and what is aesthetically pleasing and what is not. And because you want to get to this endpoint, then there's that behavior that then comes. And I find that for me, I have a lot of people coming in who would want to, oh, can I get this surgically kind of done, or can this be sucked out for this to look this way? Can you refer me somewhere? Do you find like there's that unrealistic expectation initially before you've spoken to people? And like, do you sometimes have to refer to, be it psych or even plastic surgery?
So definitely a lot of unrealistic expectations. So part of what I do is that we set realistic goals and try to tell them about setting SMART goals, you know, with the realistic timeline, and also looking at your body shape and realizing that you can, this is where you're at and what you should focus on, and focus on you, not someone else, and not comparing. Referring to psych all the time. I think mental health is super important and affects your eating behavior significantly. So definitely referring a lot to psych. And then in terms of plastics, if I have like a really obese patient that's lost a lot of weight, for example, like 60 plus kgs, then I think it's all the loose skin folds and stuff that then starts affecting the patient that we can obviously look into surgically sorting out so that they feel a bit better about themselves. Yeah.
This is me personally. This is something I've been wanting to really know about. I hear a lot about it. I've discussed it with people, but you know the concept of like a body type. So you have the ectomorph, mesomorph, endomorphs.
Yeah.
Is that actually a good way to classify how people's bodies are, or is it too kind of pigeonholed to say, oh, you're an ectomorph and this is how you'll always be? You'll always be a bit leaner. You always tend to kind of lose the weight. Or is it better, the better systems to describe the body?
I think I don't really use that system, because then it still kind of makes you not unique. It's like putting you in a box. So I just try to make everyone feel that they're just special in their own way and that's who they are, versus classifying that. But I know, like, obviously scientifically where they're at and what the weight loss is going to be like in which areas. I mean, it would be great to tell your body where to lose weight first. I mean, we'd all love that. But sometimes you have to be realistic about your body shape, you know. And then we do have genetics. You know, I don't know if you know about genetic testing now, looking into DNA. That can also help you a lot, and maybe help patients to see that actually this is the way that they are meant to be. And we're just going to work with that and focus on working with that instead of trying to be unrealistic about everything else. Yeah.
So when it comes to kind of that DNA mapping, how does it work in terms of the general principles, and then how do you actually use that to be able to
Yeah,
better
so
adapt?
it looks at nutrigenetics, nutrigenomics, or epigenetics. Yeah, so we do like a saliva swab. And then we send it down to the lab, and then there's different sort of tests. So there's looking at the health profile, so it looks at inflammation, methylation, so how your body is repairing DNA, and all of those things. It's basically looking like, if you have to think of like a river, like upstream. So we want to prevent disease versus cure disease, so seeing what you're genetically predisposed to and then working with that to prevent. So in terms of what we were talking about, weight loss, it also tells you with the different food groups like carbohydrates and fats, what you're less likely to metabolize better, or you know what I mean? So focus more on like a Mediterranean style diet or a low fat diet or low carb diet, just for some direction. I think inevitably I still make it balanced, but just try to tweak it a little bit and make it extra personalized. And then there's also DNA Sport, which then helps if you're training a lot, to know about whether you're more power training, more endurance training, your injury risk, the recovery time that you'd likely need based on like your muscle fibers. So it can get really interesting. Your caffeine intolerance,
Let's not talk about
caffeine
that.
metabolism, just so that you know,
understand.
like, how soon before your workout should you take the caffeine for it to actually be effective in your session? Are you a faster metabolizer of it or a slower metabolizer? So DNA can tell you that. It's pretty cool, yeah.
Okay, so I will just assume whenever I take my caffeine is the right time to take it,
Yeah.
because I do like taking it a bit too frequently.
Yeah.
But in a case where somebody might not be getting the DNA testing and be able to be looked and mapped out so well, what are some of the general principles you would give to people when it comes to kind of the nutrition? Because I know for me, far not as knowledgeable as you may be, but I always say kind of general principles is like whole foods, less processed, because you want to be able to kind of increase gut transit time so that food isn't just kind of passing through. And then things like sugar, the discussion around how kind of the refined sugar and what it actually affects in terms of the body and low-lying levels of chronic inflammation. But like if I was at home and I just wanted to tweak my diet and make it a bit better before I come to you, as you guys should. She's got amazing recipes that she has both online and on her Instagram page. But what would you say are some of the core principles for?
Well, first, let's start with the mindset change. So I think the word diet, I know it's part of my occupation.
I was going to say.
It's my job title. But it's like seemingly something that implies that you would start and stop, right? Not something that's sustainable. So not to look at it as a diet, but as healthy eating. So we just want to eat healthy. So we're not going to start and stop it. It's the food choices are going to remain the same, but what we'll adjust is portion sizes based on your goals, right? And in terms of the balance, including all food groups in the correct portions for you based on your goals and based on your medical conditions and whatever it is. Nothing is restricted. So also when it comes to sugar and like treat foods, so I don't also say like the word cheats, because we shouldn't cheat on anything. So we shouldn't cheat on anything. So just refer to them as treats. And then I usually say like the 80-20 rule. So 80% of the time not having them and 20% of the time we can have them. Because I think by completely eliminating them, like the psychological factors behind it is that you feel this restriction and then it makes you want to binge on it when you do see it, versus like it's Tuesday and if you feel for some chocolates, like you can control the portion and have a little bit, versus waiting till Saturday, which is your cheat day, and then having an entire slab, which would be then counterproductive to your goals.
Thank you. That's why I have a bit of ice cream every day. I think you've just listen, cheat 80-20. 80% of the day I'm fine. 20% I have the ice cream. When it comes to just some takeaway points, so I'm at home and I just want to take 5 salient points from the discussion today. What would you say those are?
5 points, okay. So definitely to include a balance in your diet, so not to be restrictive and remove any food groups. Fruit and vegetables. So in my practice, definitely see that people don't eat enough vegetables every day. Definitely not. Some people don't even want to eat fruit. So that's a good place to start. I think the mindset of being inclusive versus what you have to exclude is always better, right? Because I tell them, if you start eating all the things you're meant to eat, actually you'll feel so full and you won't miss all the things you're not supposed to eat. So that's a good way to look at things. Enough protein, particularly with the females. I don't think we eat enough protein, so that has like a high satiety value, so it keeps you fuller for longer, and then they don't have enough of that, which makes them eat more of the other food groups. Not to hate carbs. Carbs are good. The good carbs, the healthy whole grains.
I love that you looked at them when you said it. You were like,
carbs
not
are
to
cool.
hate
We team carbs. Yeah. So just to include that, obviously in the right portion, and then the healthier ones. And then to watch your fat intake as well, because that's where the calories come in.
Yeah.
You know, of all the food groups, it's the most energy dense, and it's easy to add a little bit of extra oil to make it tasty, but they're not so good for the abs. And then just watch your treats. Treat foods, the 80-20 rule that we spoke about.
Yeah,
So 20% of the time. But yeah, I think ice cream is quite nice. That
There we
is
go.
my treat that I go to.
Every single day for some of us, and she gave you 6 points.
Not
so
every
she
single
gave
day.
you
It's not every single day.
I'm not saying it as a dietitian, but I'm saying my life is a lot richer because of the sugar. But that's 6 points. That's an extra one. And I think, especially with the protein, the satiety level when you've actually eaten enough protein is very much underrated, and people don't talk about it, because if you get enough, you tend to find that not only are you fuller, but you also are able to kind of feel like you have a bit more energy, I found.
Yes, and then I also find, like, with the weight loss, people focus on the total kg loss, but not really looking at the composition of that loss. So with my in-body scale, which tells you body fat mass and skeletal muscle mass, obviously try to show the patients that you just want to lose body fat. You want to retain all the muscle you have. In fact, try to get it the high end of the normal range as much as possible. So it's not only about kgs on the scale, but the composition of that. And protein plays a big role in that, yeah.
So we live in an information kind of world, and you are one of those touchstones, thankfully, trying to give out good information that's based on some level of research and experience. I like to try ask people, especially specialists, who they find they go to and are a reputable, kind of good, knowledgeable space or a platform. And I generally will take about 3 of them, if you have, that you would suggest somebody kind of go to for information, be it a YouTube channel, be it a person that you may follow on social media. I'm pretty sure you don't follow anyone on social media, but some people that you've seen are quite knowledgeable.
Well, in terms of dietitians,
within the wellness space, and hopefully they do throw in nice recipes as well.
Yeah, so I think everyone should follow like our dietitian association. So then you have access to all the dietitians, because there's so many. Yeah, so it's ADSA. So that's our Association for Dietetics in South Africa. And that way you'd have access to any private practicing dietitian in your area, so that at least you can find one if you're wanting to look for one. Yeah, so maybe if you'd want to follow that account, and then they often post any sort of dietitians that have been in the media, so all the resources and links to it. So if you need to get some proper validated information, you can always get it off there. I'm trying to think if I...
I mean, you're in there just, so of course you have to go follow you, but that's it, just one?
Ooh. You're asking me a question.
You got things you must have a tough like standard then.
I think I do. So I read like journal articles. Like I'm very science-based like that. In terms of social media, I can't say that I really
come across something that's as
Oh, so I actually like Australian dietitians for some reason. I don't know why that happened. So there is this cool guy, Aiden, the dietitian, and he like I think our mindsets are the same, and also the way that we see patients, and also not being so restrictive, and just great information or great resources, especially for training. I think a lot of people care a lot about sports nutrition now, like going to the gym, what do they eat before, what do they eat after, how do they calculate this? And I think everything's on his page, and it's so scientifically sound and easy to understand. So he's really quite cool, yeah.
Nice. I mean, clearly that just means she feels like she is the knowledgeable, like she knows what she's doing. She doesn't look around.
Confidence in my
knowledge. I like that. I like that. But before I go, I just wanted to know, as somebody who's done quite a lot of training, and I mean, when it comes to shoots and things, I'll kind of be like, okay, I know my macros and I know my micros and like calories and the amount of calories. Do you find that, I mean, we talked about the behavior that we have around food and the thought process around it, but is it good to know where your calorie point is and to kind of try stick to that on a daily basis or even a weekly basis, because you talk about the net that you have.
Yes, I think it's better to look
Do you
at it
think it's
weekly.
better to look at it? Yeah.
Yeah, so rather to look at a weekly average versus like every day, because then it also allows you for maybe on weekends to have a little bit more, and then in the week you can have a little bit less to sort of balance it out if you have something coming up or if you know something's coming up. But honestly, in terms of tracking, it can for some people get a bit much. Also, the apps and whether the food items have really been proper, like validated. I mean, I've seen some shocking sort of nutritional breakdowns of stuff. And I think that also makes you a bit too pedantic. And then it comes into the eating behavior and then also fearing things. And then maybe also a bit of disordered eating. If you see like, oh, I've just got like 200 calories left for the day. Let me see what I can find in my cupboard. You know what I mean? Yeah. So I think rather knowing your portions of everything and sticking to that more or less and sustaining that versus like on the money, exactly how many grams, unless you are a professional athlete training for something, completely different approach. But for the layman, I think rather be more comfortable and just knowing your portions and being consistent with that versus tracking and worrying about that. But if you went to a dietitian, I mean, she would give you a meal plan with those portions for you, so you wouldn't have to track anything. You just need to stick to that, and then you'd know that you're on track.
And it also stops me having to ask you what your weekly caloric count is. I think a bit of a personal one. We'll stop there. We'll stop you. Thank you so much for sitting down with us.
Thank you for having me.
You've been a wealth of knowledge. Hopefully we'll be talking about other things around kind of nutrition and especially the food mindset. I think that's a really great topic to kind of flesh out because there's been all sorts of transitions. And I feel like COVID has been a touch point for another transition when it comes to it, and body positivity and all of these other topics. So we'll be seeing your face more often, hopefully.
Yeah, I look forward to it. Thanks for having me.
Well, there you have it. Another interesting, informative episode. And hopefully you've taken a bunch of nuggets that are going to have you feeling far healthier, maybe not necessarily slim and trim, but healthy and well.